Does healthcare scare you? What about health insurance? For many Americans, healthcare and insurance are very scary things. Most people don't even know how the medical system works or what will happen to them if they get hurt. Many don't know what insurance will do for them or what a fair price for insurance is. The medical system in America is not effective. Over many years, many factors have played a role into why the medical system is not working. These include rising costs of insurance, medical errors, inequality issues, and the introduction of Obamacare.
In 2015, 1 in 4 privately insured adults said it was difficult or impossible for them to pay their premium costs. Health costs are slowly rising, however, deductible costs are rising much faster. This means that patients are responsible for more of the cost. Since 2010, deductibles have risen 67%, while premiums have risen 24%. These higher medical costs account for higher out-of-pocket spending.
So for me, I'm a little bit insulated from the actual payment process, but pretty much every day I see people who are either come to the hospital emergently and know they can't pay, or know that their care will essentially bankrupt them. Just for me, I often meet people on the worst day of their lives. They're coming in for an emergency surgery of some kind, and even the cheapest surgery is going to be $30,000 or $40,000 by the time they get through the operating room in their hospital stay.
The insurance premiums in the United States, since the Affordable Care Act has been activated, is very costly to the middle class, very costly to resort areas in the United States. We're not on an even playing field. People in other parts of the country have a lot lower premiums than we do here in this valley.
For joining a group health insurance plan to cover you and your family, you should be expecting to pay about $500 per month. This is a problem because patients are required to pay more with insurance for the care they need. If they are uninsured, they are less likely to seek preventable care for major health conditions. People without health insurance have a 40% higher risk of death than those with health insurance. This is a result of being unable to acquire necessary medical care.
Okay, they have to take it out of something else. It comes out of activities for their kids. It comes out of paying for food. It comes out of paying for rent. It comes out of all kinds of other places. So every day.
Obamacare gets its funding from increased taxes on assorted things, including insurance policies and Medicare, as well as a fee on insurance providers, which increases the cost of health care for others even more.
What do I think about Obamacare? I think in general, it's been shown over and over and over that the more government gets involved in healthcare, making decisions for doctors instead of doctors making the decisions, and that's kind of part of what Obamacare and federal regulation does, that the worse the care is.
Obamacare has brought health insurance to many people who couldn't afford it. However, it has left many people paying even higher costs for health insurance. This is because they didn't fall under the standards to get Obamacare and had to find a different provider.
The things that Obamacare was supposed to do, reduce premiums, it's only reduced premiums or the cost of insurance for a small percentage of people. It's enabled other people who don't want to ever work and pay for their own health care to get it for free.
Expansion of Medicaid brought by Obamacare allowed certain states to opt out of Medicaid, meaning people in these states who could not afford health care couldn't get the care they needed. The Affordable Care Act requires everyone to have health insurance. If you do not have health insurance and do not qualify for an exemption, you are charged a fine which is assessed on your taxes. In the medical industry, quantity over quality is becoming more of a reality. In 2000, it cost $4,878 per capita for medical care. In 2010, it cost $8,917 per capita. It's common for doctors to be asked to see patients every 15 minutes, sometimes even every 11 minutes. This takes a toll on the patient-doctor relationship and keeps patients from being more involved in their health. Also, shorter visits make it more likely for the patient to leave with a prescription instead of with a behavioral change.
Surgery, and that costs on the upwards of $40,000. The doctor which did the surgery, was wonderful, ended up collecting his portion of that $40,000 was $7,000. The rest of it went to the hospital facility.
I also see a lot of people who make choices about their health care based on not being able to afford it. So they come to the hospital much later than they would have if they knew that it was affordable. Or they stop taking medicines that they can't afford, so they end up in the hospital for something. Or they say, well, I know that I should do this to take care of myself, but I can't afford to do that. I have to go back to work before I'm fully healed. And so then they have worse outcomes, permanent injuries, and
The
so
medical system in the United States can be very intimidating for many people. But as we look at it, they have every right to question the care they are receiving. As we have discovered, there are many flaws in the system, and that is preventing many people from getting quality care. American healthcare isn't effective because of the amount of money we spend on insurance and care and the quantity over quality aspect we see today.